Because if the trauma is what happened to you when you were a kid, or what happened to your son when he was very small, or what happened to me when as an infant, if that was the trauma, there's nothing we can do about it, because it happened. But if the trauma is what happens inside of us, those disconnections, that can be repaired. And that's what your program is all about. The essence of trauma is a disconnection from yourself. And trauma is not what happens to you. And your teacher and my teacher and friend, Peter Levine, he's the one that pointed this out. And that trauma is not the external event that happens to you. It's your body's response to what happens to you. And when people are being stressed and traumatized and they're young children, and there's no one there to hold you in that pain or that stress, the trauma, there's a wisdom in the trauma, is that you disconnect from yourself because it's unbearable to stay connected. That disconnection then creates all kinds of problems later on, but it comes along originally as an adaptive mechanism. So the trauma is both a wound, that's what the word actually means, is a wound, but the wound is, so trauma is not whether you're abused or your parents don't know how to love you, or your parents are troubled or addicted or violent with each other. Those are not the traumas. Those are the traumatic events that evoke the trauma. But the trauma is what happens inside you and begins with that very disconnection.
Many people come and ask me like, well, how do I know that I've had trauma? And my question to them is, are you disconnected from yourself?
Yeah. Are you up in your head?
Are you up in your head?
Yeah.
Do you not actually want to be in your body? Do you not want to feel your body? Does that feel overwhelming to you? Because I'm looking for present day patterns, not some event that happened in the past. Are you disconnected from yourself?
And I think both you and I, in our approach to healing trauma, the past is important perhaps in understanding things, but dealing with the past doesn't help you. You have to deal with what's happening in the present, in your body right now. That's where in your body, mind, what's happening right now. That's where the healing actually is. And that's what's so frustrating here, Aimie, is that we're not just talking theory here. We're talking about people that we're not promising magic cures or panaceas, but in so many cases, whether it's multiple sclerosis or lupus or arthritis or depression or addiction or anything, people can do so much better if they only are guided to deal with the traumas and to become their true selves in the present moment.
And as in the 21 Foundational Journey, we have these days where people have open shares. So they're able to share what is happening to them just as a result of the work that they're doing and connecting with the body, creating these different experiences themselves. And people started telling me, sharing with the whole group, like, I got off my pain medication that I've been on for decades. My emotional eating pattern just disappeared. And I didn't even do anything consciously. Like I didn't want to overeat anymore. Or another lady got off of her thyroid medication for hypothyroidism that she'd had since her early 20s. And she had an alcoholic mother. So all these things people were sharing, and I was like, could this be true? So I started studying it. Of course, like a good researcher, right? Like I want numbers. I started giving them a survey before and after just to be able to measure this, to make sure, like, are they not just saying these things to make me feel good, right? Like I want to know for sure this is real. And I still do this. So everyone who takes the 21-day journey, I still do this study for them. They'll fill it out. And what the numbers that we're getting back are 26% decrease in daily physical pain.
This is in 21 days?
21 days. Safely opening up, safely learning how to connect with the body. And I use that word safely intentionally, because that was one of the mistakes that I made is for myself. Like I jumped in too much, too fast, too deep, too fast. And I actually caused a lot of flare-ups in my health symptoms at the time.
Peter Levine talks about titrating our intervention, doesn't he?
Yes, I had to learn that the hard way because of course, being the personality that I had, coming out of my childhood, I'm going to push myself all the way. More pain is better. And one of the lessons that I learned was actually the more that I push my body, the slower it goes in the trauma healing process.
Yeah.
So they have the decrease in daily physical pain, but their digestive system. So most people with trauma have some form of digestive symptoms because of the vagus nerve, and people were experiencing a 28% decrease in their digestive issues, 28% decrease in sleep issues.
By the way, again, this is where it gets frustrating. There's so much research connecting childhood trauma, for example, and irritable bowel syndrome, or inflammatory bowel disease. But you go to the average gastroenterologist, they haven't got a clue. So people never hear about it.
No, it's very siloed. The digestive system is over here with the GI doctors. They don't even talk about the nervous system. They don't even talk about the immune system. They don't talk about anything else other than the digestive system. And in that siloed view, they're missing the big picture.
Yeah. Missing the big picture, I think, is the big theme. And I think the work that you and I try to do, and certainly your 21-week program, is all about taking in the big picture, isn't it?
It is. It's taking that big picture and saying, this is what it means to have a healthy nervous system. This is what it means to actually be in our body and not be in our head.
This work that you're describing is all within the body and within the individual. And yet, as both you and I know, so much of people's stresses and traumas happen in a context. And there's a reason, for example, why 80% of autoimmune disease happens to women. And I think that has to do with the role that women are culturated to undertake in this particular society, of suppressing themselves and serving the needs of others. And those people are the ones who typically get autoimmune disease. Now, do you address those issues in your program? I'm saying for health, ultimately, you also have to make a change in your relationships to the world and what you take on and what you don't take on. So what do you say? What do you got to say about that?
This is one of the scariest parts for people, is that I need to connect with myself, but connect with other people. Oh, like now you're talking about something that has been overwhelming, and I don't want to do that. I want to do this work in isolation. I want to this be something that I can do on my own, or it's just me and my therapist, and I'm not really forming a strong relationship with them. And it's a therapy relationship anyway. So what I have found is that people come to me, and the more high functioning they are, the more they want, can I just work with you directly? I only want to work with you. And what I tell them is that if you want the best results, I need you to do this in community.
I used to work in palliative care. People that were terminally ill and they were not going to live, No, there are, by the way, there's interesting examples that have been studied by people that both you and I know, of people that are given terminal diagnoses and all of a sudden they get better and the illness goes away and the doctors say, what the hell happened? Well, what happened is that there's a powerful transformation that happened. But even with people with terminal illness, I've seen expansion, where they weren't going to live longer or much longer, but how they lived and who they were. And this is what, again, I don't recommend this, but maybe you've seen it, but I've seen it. When people say, doctor, this disease that's taking my life is the best thing that ever happened to me. And not because I want to die, but because I connected with myself, and that's more precious than anything else. Have you seen that? Have people said that to you?
Yes, I've seen that. I've seen that a lot. And for me, in those moments, of course, I'm right there with that person. And then it also makes me think of all the other people. And let's not wait until that point to realize that the most important thing is for us to live authentically and even figure out what that means.
Exactly.
Because again, for most people who've lived since childhood to a degree disconnected in order to protect themselves at that time, they don't even know what authenticity is.
Yeah.
They don't even know that they're disconnected half of the time, Gabor.
So, doctor, do you have a practice yourself that you follow in your personal life?
Absolutely. Yeah. this isn't something where you can just do it once and then never have to do it again. Like, this is a daily, for me, I don't want to use the word practice, but I suppose I could. It's just like, this is how I live my life now. And now when I disconnect from myself, I feel it, because it's so different than what I have become used to, which is being embodied and being connected and being attuned and listening and being in curiosity. And so when I lose that, and usually it's always because I'm responding to something in my external environment, right? And I lose that disconnect, like I feel it, and it actually causes me stress. And so that's my cue. It's like, oh, I need to step away. I need to go reconnect with myself first. So for me, it's become just so much of how I live every day, how I live life now, which is so different than all of how I lived life before until I did this work.
So ultimately, I think we're teaching people to really listen to their bodies and not to see disease or symptoms simply as problems, but my God, when those things show up, you can learn. And I think both you and I have found that when people learn from them, they can heal.